My name's Hannah Kuper and I'm the Director of the Disability Centre, which is at the London School of Hygiene and Tropical Medicine. And since the start of the Zika epidemic in Brazil, I've been working on a number of projects. First, to look at the social and economic impact that Zika had in Brazil, both on families, communities, health professionals and the country at large. And then to use research to develop a parent support programme to support the carers of children with congenital Zika syndrome and to see how well it worked. So the parents have formed, particularly the mothers, very, very close networks supporting each other and providing information to each other about Zika. And it's a very trusted source. So many of them are informal, like WhatsApp groups, or more formal, where people come together and meet. And this has been very important to provide social support to the families and also to provide information and guidance. So it's been really, really critical. In the parent support program that we've established, we get the parents together, about 10 parents, once a week for 10 weeks, and we give training on different kinds of topics like feeding, communication, play, but also things like what are your rights and how can you access those rights. And that's been really crucial to help support the families in how to best care for their children who have often very complex needs. So it's been really, really important, these kinds of interventions. So we've communicated a lot with different parents, particularly mothers of children affected by Zika, and there have been three really key concerns that they've had. The first is that lots of them are in lots and lots of different research projects. It takes a lot of time and that they have to answer the same questions and go through the same kind of examinations over and over when they're already very time limited. The second issue is that this information is very rarely reported back to them, so they give all of this input into research studies and then they don't hear the results, which is very frustrating and sort of undermining because it's implying that they're not intelligent enough to understand. And then the third is a lot of frustration that they don't see the benefits of the research in terms of provision of services for them. And so I think in future epidemics we need to be better on three fronts. We need to coordinate our research much, much better. We need to make sure that information gets relayed back to the families and back to the people who gave the information. And the third is we need to make sure that our research influences practice and positive change for the families and the people affected. I think it has to come a lot from the donors and donors' guidance, and I think with Zika that tried to happen and maybe it went so far but needs to go a little bit further. And I think it's difficult in an epidemic because everything's fast and rushed. So maybe a lot of that thinking has to happen before the epidemic in preparation for the next one. So a lot coming from the donors in how they give the funding.